Give it a couple more minutes for some folks to call in. Hi, Mr. Lawson.
Hi, how are you, Dr. Bell?
Good, how are you?
Very good.
So I'm just looking at who's on. So Maria, what do you think? Are we waiting on 2 more? This is like Hollywood Squares. I'm aging myself, but it's like as people come on.
Hold on 1 second, my computer froze, so I have to get everyone square in my...
The internet today's been a little slow, I think, with the windstorms. I know it went off at our house, but
I was gonna say, I got bounced twice today.
yeah.
Completely, I had to shut my computer down and back up again because it just goes black. So if I disappear,
Okay.
I'll
Log
be back
back
as
in
soon
and
as I
we'll
can.
pause, and if it's easier for people to leave their videos off, we can do that too. There are a couple of things we're excited about we wanted to show you tonight in particular that we'll do early on here, and I think.
I believe we're waiting on 3 more.
Okay, so we'll just give it 1 more minute and then and we can start. And we are recording this, and we'll put everything out and send an email summary tomorrow as well. Okay, I don't see anyone trying to log in, so I think we'll start, and then if people get on board, we can briefly bring them up to speed and do some summaries. But we do have a few things we want to show you tonight. So thank you all for attending tonight. You know, we're starting to heat up pretty quickly now with plans, even though we don't have hard dates yet for the launch of the study because we're waiting on COVID and to see where we are. Believe it or not, because of all the planning that needs to take place, we need to start getting protocols finalized and be ready to go so that as soon as it's safe and we get the go-ahead, we can begin recruitment, hopefully sometime this summer. One of the first things we have to do is actually in both communities identify a clinic site where we will have staff that will be hired to work on this study, so phlebotomists as well as staff that are trained to administer some of the neurodevelopmental testing we'll do with the kids and to measure the take the urine samples and the blood samples and process them. So we'll have staff at the site, and then obviously for the families to come in to the visits, and remember we have both adults and children, so we need a large enough space. So one of the first things we did is we've subcontracted with Research Triangle Institute, and Suzanne is on tonight, and I'll let her speak in a couple of minutes. So thank you for joining us, Suzanne. RTI, as I mentioned last time, they spend all of their days conducting large cohort studies, and because we had 2 communities that were far apart from Albany, we wanted some extra assistance with the data collection of this phase. And so RTI is also working with the Michigan site and the Pennsylvania site. So it also gives us, also helps us in terms of coordination across the sites with communication and sharing resources. So this is also very helpful. One of the first things, as we talked about last time, is that we have to identify these sites, and it's always a bit of a challenge because we need a site that meets a bunch of requirements for health and safety. So we have environmental health and safety rules that we have to follow for research. They have to be ADA compliant. they have to be big enough that we can have staff there on a regular basis, and then also have some privacy for the testing to be done. We need to have a -80 freezer. So those have actually been in the news a lot lately because of the COVID vaccine, but we use them a lot in research. And so we need space for the freezer to store the samples until we can get them shipped and things like that. So we also had met with RTI and shared that we wanted sites that were central and that people could get to easily. In Newburgh, we wanted to make sure there was a bus stop right there and that it was familiar. So RTI went out, Suzanne worked with her folks, and they identified a site in both communities that we want to show you and get your feedback, and to see, and get your thoughts. I'm hoping, based on what I've seen, that they're familiar to you because they are former clinic sites and that are no longer occupied. So I'm hoping that that it's something that's familiar to you for that. So Suzanne, do you want me to share my screen or do you have them up there? Or actually,
that would be great. Do you have them up, Erin? I do too, but
I can share. Let me post. So the first one here is Newburgh, and this is on Fullerton. And so Suzanne, why don't I actually, before I hit the play button, do you just want to introduce? Would you like to introduce yourself to the group?
Oh, sure. Hello, everyone. Suzanne Triplett. I am a program director at RTI International. My program is the Health Surveys and Environmental Exposure Registry group at RTI. And I've worked at RTI for over 20 years. I've worked on a lot of environmental health studies all over the country. And as Erin mentioned, a lot of what we do is supporting communities who have these important health studies going on to figure out the impact of environmental health exposures. And so we're really pleased to be able to support New York, Michigan, and Pennsylvania on these important efforts. And as Erin said, for New York, a majority of our work will be coming in and establishing a community site office and staffing that with members of the community as well, and providing kind of the structure and support with protocol implementation to these staff as you all collect this important data, both in Hoosick Falls and in Newburgh. And so what Erin is going to show you, because we're unfortunately operating under some of the confines of COVID, are two videos that our internal real estate group found for us. They are former clinic spaces, but they're hopefully as centrally located as we could possibly get for both locations. We're especially excited about the New York site offices, but we would appreciate CAP feedback at the fact that we're pre-existing clinic sites. They're really ideally situated to capture health information, and they're arranged such that when we collect blood and urine, these site offices are ideal for that because they were used as a medical clinic previously. So I think with that, Erin is going to show this link to our Newburgh option right now, our best option. We've looked at multiple locations with Erin and her team, and right now this is one of our best ones.
So this one, hopefully the snow will be gone by August, but 327 Fullerton, which I think is near the school, near one of the schools, yes. Based on what we saw on Google. And it used to be the Premier Medical Group is the sign on the door. Oh yeah, and I'm going to turn off the sound here. But is this familiar to you for the Newburgh folks? Do you know?
Yeah. Yes, it is. And, one of the things that we get from our Newburgh residents is that they want things a little bit more towards downtown. However, that location does have a bus that goes by it. And as was mentioned, it does have the other equipment that will be needed. And then there's a decent sized parking lot that's there, right, and some of the other things. So, it's not impossible for people to get to. So even though it's not downtown, I do think that it's a good option when you consider all of the other things that are needed.
Okay. do you anticipate, will people need assistance getting here? Or do you think?
Yes, definitely.
Okay.
The problem with the busing, even though there's a bus that does drive by there, our busing here in the city is not consistent. So it's just not reliable. So yes, they would need transportation, but
Okay.
that location is a good location.
Okay, so it could be we need to think a little bit about getting people to the visit. Initially, when we applied for funding, one of the components we all needed to speak to was the ability to do home visits. But with COVID, that's been pushed back so that if it would be, if we were to offer that up, we would do that at the end of the study in the hopes that we would have more time. It's logistically a bit more challenging to do a home visit, and not everyone is comfortable with a bunch of people trooping into their house to do these types of measurements. So an alternative, it sounds like, would be if we could find a way to have some transportation or a driver bring people to the visit if they needed it. We might need to think about that.
The other thing that you can consider too, I'm just adding to Councilman Grice's comments, is satellite sites where you might be able to see people. So you won't go to people's homes, but if schools are open under certain restrictions, you can take sort of the community schools model where you might be able to utilize different locations, because that might deal with the transportation piece as well, and or vans or other types of transportation to get people to and fro. And although we do have transportation, and Councilman Grice already said this, it's very limited. So I wouldn't count on the public transportation piece. So just some things to consider.
Yeah,
I had another question.
it's good. Yeah, go ahead.
Yeah, no, that's all for the location piece. I did have a question about something that you said earlier, but I'll wait for your presentation to continue.
Okay. Just a thought. So Suzanne, I had a question for, when you did the World Trade Center study, did you have transportation to clinic sites, or did you have multiple sites that people could get to?
For that study, we didn't provide transportation. That was a health interview predominantly conducted over the phone. We did have a big site office on Broadway, which was centrally located, and people could come in and take the interview in person if they wanted. We did send out field staff into the community to do in-person interviews. On other medical monitoring and treatment program efforts that RTI has been involved in, I do know that they have coordinated days where they have busing to come in if we have a clinic site. Does that make sense? So they do more outreach and scheduling such that they can get community members in on buses. We have worked with that before, and I can share some details on that with you, Erin.
Okay. I can also reach out to the exposure assessment team that did the exposure assessment study,
right?
See if they had something similar. Because these are all very valid concerns. And then we had floated the idea of also going, as Mr. Lawson suggested, going to a central location. In terms of coordinating a day, that if we could use a space and then bring everything back to the clinic site, might be an option. So these are good ideas that we can explore some more and look at the schedules to reach, because we know there are definite pockets in the community of neighborhoods and people that we have not reached previously that we want to. So and want to make sure everyone has an opportunity to participate that wants to. All right, so these are, but if we can make these other components work, this site in theory could be okay, provided we can find other options. Okay. So we'll discuss that. We have asked, this is obviously a process of negotiation and pricing. The -80 freezers require a special plug in an outlet, and we need a backup generator type situation for the freezer. So there are different things we have to explore, but we'll take, this is very helpful, and we'll take that back. Before I move on to Huzik, Mr. Lawson, did you want to bring something up?
You mentioned, I'm very interested and excited to hear about the community staff, and I didn't know
Oh, yeah.
if that was that later in the presentation, or can you discuss that now?
We can discuss that now. So this is also something RTI is working on, job descriptions now that we, again, would hopefully for our next meeting would be able to share with the CAP. But Suzanne, do you want to speak to the type of staff we're planning on?
Sure. No, we definitely will be hiring locally for staff to be trained and to run the clinic for us. We're working on the number of staff we would need at each site, but the positions include a site manager or director, and also several phlebotomists and several essentially research interviewers, if you will. So these are the staff that, in addition to the phlebotomists, they will be taking participants through the consent process. They will be administering the health interview to adults and children. So the interviewers will be specially trained to also administer the neurobehavioral assessment interview to the children as well. But these will be staff that we'll be working with and communicating with regularly, most often with the site manager, but definitely it will be a community effort. It will be hiring of local staff. And we will be visiting these site offices regularly, making sure the staff have the support they need. They have pre-developed systems to use that our data coordinating center has developed, so where they're entering the data into those systems. So we anticipate that we'll be recruiting for a period of about 6 months. We'll see how that goes. It might need to be extended. We will be hiring these staff several months in advance of the start, especially the site manager position. And then about 1 to 2 months before we actually launch the study, we'll have pretty much our full staff in place. They have to go through trainings. They have to help us get the site office set up. But it will be all local people.
In both ways. And that was important to us too when we began talking way back when we applied for funding. And because in both communities with Newburgh, we also have I know several students associated with the community college there have reached out, and certainly with Hoosick, you have HCCC, and you have folks in Bennington, you have folks here. So we're excited to be able to advertise. So once we have those job descriptions, that'll be kind of next on the big piece on our radar in terms of getting staff in place, because there is a fair amount of training that needs to take place, and also we would want people in the community to know who's working on the study and give time for people to attend events and things like that.
I think that's brilliant. And thank you for considering that. Just one thing to add, and again, this is kind of the work that I do on a national level about community engagement. One of the things, you have a unique opportunity at the onset to really engage the community in a real positive and forward-thinking way. Specifically, there are the Orange County BOCES is here, and the SUNY Orange is here, and there are students being trained as we speak in medical assistants, phlebotomists, medical terminology, all these different skill sets. So it will be a great opportunity to partner with both the university, again, to identify staff, because one of the challenges that you're going to have as far as engagement is a challenge that people have all over the country, and we're sort of playing out on the media today about health disparities based on ethnicity and culture. And so we want this to be a very robust study. We want people to be engaged, but if you don't do this right, we can have a really nice office, have transportation to go, and nobody all dressed up and nobody there to throw the party for. So I think it's a really unique opportunity for us to engage the community, engage the school system, and maybe Councilman Grice can speak to this, but I know currently in the high school, we have CTE pathways. career and technical education pathways. I think it's in law and public safety. And I believe we have it, and Councilman Grice might be able to speak to this because he's in the school system. He knows this stuff backhand. We have a health pathway for CTE. So, and the high school the school you were speaking about is the high school, and it's right across from the building that you're looking at. So
this is, go ahead.
And I was thinking the same thing, Mr. Lawson. It's right there. And actually the teacher that directs that program, she's a nationally recognized teacher. And so it just makes sense to really have some of our students who are already getting their certification in that to just, transition right over. I'm not sure if their skill set would lend itself to being office manager. I forget the exact title you call that, but certainly on the other things, I think it would make sense. And then usually, I think Mr. Lawson is being a little modest because he used to be a board member as well. So he knows the school district. But usually, when we involve students, the parents and the relatives usually just come on out because their children are involved in it. So it just really helps. And to Mr. Lawson's point, you don't want to be all dressed up and nowhere to go or no events happening.
I appreciate those comments. And we had talked internally about having programs for high school students and college students, and wanted to reach out to you to actually, it was on later on the agenda, but we'll do it now, is to get contact names from you because we want to do it right. So the high school students, obviously we have, in terms of what there are different things we can do and organize programs around. And we have a program similar here that I've guest lectured in. They could help us get the word out, help us, or, on the days of the clinic visits and things. We have ethics rules around blood draws and things like that, but they are other things that they can do. But the earlier we start communicating and partnering, I like the idea of partnering, makes sense, because I would want this to be meaningful for the high school and college students, as well as the community members that are working on the study. We had also floated the idea, and I know Pennsylvania did too, that my memory is high school students, and my children aren't there yet, that's why I'm not sure, are encouraged to do volunteer hours for graduation, so that if we had opportunities for them to volunteer, and again, documentation, and we could provide a letter and reference letters so they could put it on their resume and things like that. That was another idea we were thinking of for the high school age students as well. But if you have contact names for both at the high school, and perhaps the teacher you mentioned is the place to start, and then both SUNY and Orange BOCES that we could communicate with and start communicating and talking to them about the study, and then and developing some ideas here, that would be really helpful.
Yeah, I think that's absolutely. So project-based learning, that's how we look at this. So it's more than just community service. This is actually getting students into this whole issue, right? This is impacting their community, and they can have a real say in what happens in their community. So Councilman Grice is right? So we don't expect them to direct and run this thing, but they certainly can do outreach. And they certainly can let their church and their families and their communities know about what's going on. So
and we can train them that way. And we've talked about doing seminars, and doing literature reviews and discussions like that they can help us put information posters together and do talks and things on their own. And there are high school students up here at Albany High School that are also working on this issue in Cohoes with one of our chemistry professors. So I think there's some synergy there that we could even with Zoom have them meet one another and things like that I think are important.
One more feature to NFA that Anthony and Ed know. There's a terrific television studio at NFA and a TV program there that can be used. There are teams of students there being trained to use that kind of technology and to help spread the news and information through interviews, however they go about it, I think would be another piece of this that would help get the new word out that there is this research project going on for the community.
Well, and that was actually on one of my notes as well, because I will be meeting with our media marketing person next week. And when we get, I want to get to Who's It Falls in a minute with their location, but come back to this discussion on how do we get the word out, and was wondering if there was some local radio and print and blogs and things like that that we should be working with. And that is another ideal avenue to have the students help us with. Because they're much more up on that anyway than I am, but that would be another avenue. So great. So we'll, if you think of it, but I'll make sure Maria reaches back out to you for names and contacts so we can start these discussions and plan with that. So I think what I'd like to do is if we could go just to the Hoosick, proposed Hoosick site. And Lorene, I'm hoping, I think many of you, I think I have the right one. Do I have the right one? You might know this place.
In the front door.
Oh, let me.
Coming in the front door.
There we go. So this is at 140 Main Street. So, and it's an old clinic that's been redone. Is this familiar? Do you think it'll be, you know, will people?
Very central, and everybody knows it because they used to have, you know, family health center in there. So.
Okay. All right. And what we're thinking, because obviously there's stairs, but we would have pretty much everything involving the city itself on the first floor so that people don't have to climb stairs. In both locations, we were pleased. I mean, they seem to be relatively freshly painted, and there aren't any rugs and things that we would have to pull up. So from all of that, and lots of sinks, you know, and things that we would need. And there's a parking lot here, we've been told. So, okay.
Out in the back, yep.
Okay, so this is, will work. Okay, and then there's space upstairs that the staff can put their things and have meetings and things like that. And again, same plan here is to hire local community people and people familiar to the community. And again, we have students in their student programs that we would want to have parallel activities that they, you know, I have this, you know, hope that we could have the, you know, if we do have high school students involved, that they could all meet each other and those types of things. But again, we have resources for also for the paid positions that we would have available. Okay. So do you have any concerns with accessibility here, Lorene, or anything else we should consider for the actual site?
Not at all.
Okay. All right. So again, here, next step, we've asked for more detail. We need to get some schematics. We need to, some of the sites, we don't have this issue, you have to put in sinks and all that. We don't have that, but again, checking electrical and security and things like that we need to confirm. Okay. So that's it on the site. Suzanne, do you have any questions based on what we've just talked about?
No, the feedback has been very good. Thank you. We'll be working with Erin closely on getting more information about these locations. I think we were also looking, especially for Newburgh, about options for retail space closer to downtown. That's a little tougher because there haven't been a lot of great options that we have found yet. So we're in discussions with landlords right now on all the logistics, but we really appreciate all this input, especially the discussion around the students. And we'll look also, Erin, as folks were talking and giving recommendations, even students who participate in the study, we would like to be able to give them credit, volunteer credit. It's such an important study. If they provide information and take the health survey, you know, we'd like to give them recognition for that. So we can look into that too, Erin, for those students who have a harder time volunteering with outreach, for instance.
Right.
That might be something we could look into.
Yeah, and I know, yes.
Suzanne, can you elaborate on the retail space? I didn't understand. So when you say retail space, what do you?
Our group looks at retail space. Retail space is an option for using for setup of a site office. For site offices, they have to be zoned commercial. At least we can't use a private residence for a site office when multiple parking is required and whatnot. For retail space, it's a little trickier for us because we have to weigh the costs of putting in sinks and infrastructure. Retail space is usually wide open, but the location might be better. Does that make sense? And so for more clinic type space, you can use it. You just have to kind of build up a little bit more of the infrastructure and weigh that consideration when you look at retail space for site office locations. We were looking at that. We didn't have a lot of great options, but if you all know of different addresses we should consider and pass along to our real estate group who helps us identify these locations, we would welcome that. That's part of, I think, the CAP that we've been working with in other locations too. So if there's something that you know of, just please let us know. For Hoosick Falls, for instance, this was probably one of our best options of the tour, right, Aaron, that we gave. A lot of the other options we looked at for locations for site offices were too far outside the study areas. We walked Aaron and her team through those, and they would be too difficult to get to.
You'd have to drive to them, and
they would be too far.
But I think the Michigan has rented space in a store plaza, but it means construction costs. And because we have to have privacy, and there are some other requirements for safety. So that's one of the issues with that. So, but we can look. So if you know of if you have spaces and that you think might be worth looking at, by all means, let us know. And we can, that's why we wanted to bring this to you. So if you know of spaces in the area that people are familiar with, we can look into the feasibility, and we'll explore these other issues of providing transportation, or perhaps having the ability to go to a central location, which again, there's some rules and guidance around that, but we can explore that and work that in. We have time. So that's why we wanted to bring it to you, particularly, and we knew in Newburgh these would be issues. So we want to make sure we explore everything.
So there's definitely a location. We are actually in there right now through a local philanthropist, a not-for-profit is, and it's on Broadway. And so you wouldn't even have to go through the realtor thing. I think it would be a warmer call if we work together to do it. So I can refer that one.
Okay.
It's 385 Broadway. It's right off of, it's at the intersection of 32 and Broadway.
Okay.
And if you're interested, after you Google it, and you can do that Google map thing,
yeah.
Reach out to me, because then we can the real estate guys, they'll get it all bungled, and we can get it done.
Okay. All right. We can look at it, and Suzanne knows the rules that we can work with, and so let's take a look, and we can explore these other things too. Now, would we still need ideas for transportation if we had a location there?
Yeah, because there's buses that run, but it's
just not as good.
It's very limited. Okay. But this is on Broadway, which is the main thoroughfare through the city.
Right there. Okay. All right. We can take a look. Yeah, and again, we anticipate families needing to come in, so getting everyone on a bus is difficult. So even in the best of times. So all right. So and we'll explore transportation ideas, and helping with that coordination. All right. Anything else on the clinic sites? So the next thing I had to discuss, and we've actually started this already, is how best to brainstorm a little bit and to provide us with some ideas on how to engage the community and let people know about the study and be able to answer questions in general. And then I have some specific questions about translations, and we have a fact sheet to show you, but I wanted to just start by just kind of a open-ended discussion on how best to reach. We've spent the last few months speaking to members of the community, but it's again, folks we already have communication with and a history with, so we know we're not getting to everybody at this point. So who else should we be talking to? How best do we reach folks? What are your thoughts?
Aaron, do you have some sort of a logo or some sort of a?
Yes, and let me pull it up for you. This is actually, I was going to, so we can go ahead and start here. And this is also, some of this logo is also on our website. So this is a draft fact sheet. And can you see this? Is my screen showing okay? Okay. Yeah. So this, I know Jean is on, I don't know the difference between a logo and a graphic, but this is, this picture is what the full multi-site study. So all the sites will be using this picture with the water drop and the checkbox for a questionnaire and a survey for all the sites. So and this is the color scheme of the multi-site study. In New York, and Gina is on from the health department who helped us work on this. We will also be using this picture just to show we thought we wanted to very much, and this mimics a picture that Keys, New Hampshire is also doing something similar, but we wanted people to know that there are two communities involved from New York in the multi-site study and about where they are. We wanted people to recognize kind of where they are in this study, and to know that this is a national study and that we have two communities from New York involved. The other reason this was helpful for us is that other communities are starting to be informed that they have PFAS in their drinking water and have reached out to me and to others, and I've given some talks, and we wanted to make sure that if they saw something like this, to understand that this is a set study for these two, for Newburgh and Hoosick Falls, but that the findings from this study will certainly be helpful for them as we move forward.
When we were talking about the television studio at NFA, these images are good. There's artwork involved here to help present an idea, and I also think NFA has quite an art program too. My son went through it actually, but that kind of information and making posters and presenting the posters in different places around the community would be another feature for getting the news out. Okay. I think is it also possible to link this with the Washington Lake issue and making sure that people know that that's where this is coming from?
The source of the PFAS?
Yeah.
Yeah, we can definitely, I mean,
there's an environmental issue as well.
It is an environmental issue, yes. So it's certainly in all of our talks, and we can definitely work that in. And I am more than happy to work. I think it's a great idea to have art students, as part of our presentations, to take this and use this as a communication tool as they express themselves on and teach, help us inform the community, not only about the study, but about PFAS in general. And so, yes, not in this document, but we have other documents that explain the source of the PFAS and from Lake Washington, and that's on the website, and some of our other fact sheets related to the biomonitoring. But we can, in additional materials, provide some of that in the history of it as well.
Okay.
But that's an excellent idea. I like the idea of bringing in. And I knew Newburgh in particular is interested, whenever I talk to the community, and having an art focus is certainly something very important to most of the meetings we go to.
Yes, yes.
I just have a question. So the fact sheet is great. This is the first I'm seeing it, and
yeah,
and typically coupled with the fact sheet is sort of the approach to how you're going to accomplish sort of the goals in this application. And does that document exist as well, like sort of your approach to this work, or are we talking about that as we speak, or are you?
So that is probably the next thing we need to develop. So this is just a one pager back to back that we can either print it as two separate pieces of paper or one, or obviously it'll be on websites and Facebook pages. But in terms of the process of the study, this is obviously just a general overview. And the next documents we have an what we call an FAQ sheet, but certainly I think what I would like to do with all of you is develop some ideas on what this next document would look like that we could hand out that explains the study and the steps to the study, how people will be recruited for the study, how they can enroll, and we have, I mean, this is and what we talk about a lot, there are a lot of different components. We have the main study, but then there are some additional smaller components that are part of this funding as well that are helping us to address these questions. And so how do we, it gets complicated pretty quickly. So we're looking forward to your insight as we move forward on how best to communicate that.
Hey, Erin, I don't want to take up much time from the group. Hi, everybody. I'm Jeannie Gallinger, and I work for the Department of Health. But I just wanted to provide a little context about this fact sheet. We had developed this really as a first piece. It was designed to initially brand the studies in this area, make it clear that this is part of a national effort. And actually the look and feel and the information on these sides of paper mirror very closely those that were developed by ATSDR, and that was done on purpose. We were envisioning that this might be a good initial tool to launch out the door first and familiarize people overall with the study and the objectives of the study. Side A really talks globally, and it would be applicable for people even outside of the Hoosick Falls and Newburgh area, just to understand how New York State is participating in the national study. Side B was designed really to aid in recruitment, so that people in your communities would understand what we're asking of them and how they're being asked to participate. So it was really something that we thought we could easily translate, slip into recruitment packets, and kind of build off of as a first tool for familiarizing people with the study. And I think that the ideas that I'm hearing on this call are really exciting about taking this information and using local people to provide input to more customized tools developed by the community for the community to help promote and get the word out. In addition to, I think I heard also some interest in something like a process document that would kind of explain all the parts of the study and how it unfolds. I'd like to hear a little bit more about that, if what you guys were thinking about that, so I can make sure that we have that in the communication plans and can help with that. And I promise I won't talk anymore. So thanks for listening.
This is great. Thank you, Gina.
That was really, so can I just jump in?
Yeah.
I'm sorry. So I'm excited too. So I apologize before if that translates to me talking a lot. This is really exciting for me. And to Gina's question, typically my approach is inquiry first, right? Who, what, where, when, why, and how, right? And so, for example, let's take this document, and I really appreciate that Gina sort of made that point. It does read like a preliminary document. And one of the things that you would want to see is, what are the goals and objectives? So if I look at this document and I'm reading it, I'm pulling certain things from it, but I'm curious, what is the goal and objective of this study? I see what you're saying, that you want to collect this information and you want to do this and you want to do that. I mean, but as far as community engagement, what's really important is to be really upfront about what your objectives are, to be really clear about what your goals are, and then we can go through that process of implementing a program that allows us to accomplish it. I think one of the challenges with programs like this is getting community buy-in, right? Getting community to see things as you might see them and really feel like this is sort of worthwhile. And we talked about this in one of the other calls that we had. And so again, the question needs to be about you're not just coming here to collect information, blood samples, urine samples, and to do your research study and then go write this tremendous paper and win awards. We're really doing this because we want to try to improve health outcomes for people in this community. So our narrative needs to be reflective of that. Even though we know that you're collecting blood samples and urine samples and you're going to do this research project, if you go to the people like that, then they might react like that. They won't embrace it and buy in. So when I'm saying what I'm saying, I want us all to embrace that narrative so that it becomes about we as opposed to I, and then we don't have these sort of factions. That's why I was so excited about the community staff piece, and when Jack chimed in about how we can engage the community. If they buy into this, you'll get way more than 1,000 people just from Newburgh alone if they buy into it. But if so I want it to be more inclusive, and I don't want it to seem mercenary, like you're coming in and you're doing something and then you're leaving, even though you're paying people to do the research. I think it can be more, and I appreciate that this is an initial document. So I guess the question is how do we make this document more inviting and engaging?
Yeah, and so what do you think? I mean, do you have ideas? So let me back up a second. So I fully agree with you, and it's very important that I don't want to leave the impression, even though this is a science study, we don't want to come in and just do the study and leave. This is, we will be giving people the results, will be reports, and working with them and the clinicians to interpret the results. And we intend for this to be multi, back and forth in communication with community members and adding components based on their feedback. So this is, we want the community engagement to be there. Yeah.
And we got to say that.
Okay.
So let's just take this for example, a multi-site PFAS health study goals. This is what we're saying the goals are. This study will help scientists, not community, help scientists learn about PFAS and human health effects, including these things. Now, how can we say that in a way that it's sort of it's not just going to help scientists, it's going to improve health outcomes for our community? How do we say exactly what you're saying here in a way that, wow, this is great. The community now, because of this study, will be able to understand a little bit more about, first of all, water quality and how some of these things can affect our health. And our kids are involved, they hired locally, and we're in this together, as opposed to how it reads like, and again, I'm not being critical, I'm just saying this is a preliminary document, but you can see how you can make it our document. It becomes our study, it becomes our attempt at improving conditions for this particular community. A community, by the way, that's been neglected and been abused for 40 years, and PFAS has been subjected to us. We haven't had any money coming to the community to actually understand what is actually happening. And so we don't. So if we embrace that, I think, we can.
Well, yeah, no, fully. And again, what I've told many communities over the last few months is the money for this program nationally came about because of the activism and the advocacy of, both Hoosick Falls and Newburgh and the just like has been happening this week, to make sure the money was available to do these health studies because of the questions we have. So we want to make sure that there is ownership.
Yeah, and you can reward that and lean into that as part of the narrative. Okay. You guys did a great job, and as a result of that, we're first off the block to be able to study and benefit from this study. And here it is, and let's go.
Okay. Okay, so we'll have, one simple idea here is that we can help community, certainly include the word community with scientists. That's an easy update, but I think based on what I've said, are there other areas on this page that we could update that you think might be helpful?
Yeah,
we can send this to you as well.
Yeah, if you go up to the top, it's the same thing. So if you go up a little bit about the study, yeah. When you read about the study, this is about the study, but this study is about the people, right? So the multi-site study, it includes people from Hoosick and Newburgh, but sort of make it more personal and then engaging. And we're in this sort of this fight together. And we're going to learn about the impact of this PFAS on our community. Because Jack, Councilman Grice and I, we were on a call yesterday with our team locally, some of our team locally, and part of we're asking questions that we don't even know the answer to yet. Like, we don't know where the PFAS came from. We don't know if it's continuing to impact our community. The system that is in place is an interim Band-Aid system. And we don't know when help is coming, right? So, and we don't even know if we have been impacted, if there's a cluster of, we know a few people that have died from cancer.
How severe was the impact of contaminated Washington Lake on the health of the people in the community?
We don't know that.
Cancers, do we have a lot of cholesterol issues and low birth weights and all the other things you mentioned, kidney concerns and so on? That stuff will help us push our case to the DOD when we have our RAC meetings.
Mm-hmm.
So yes, the connection to the community is and getting the community. It's almost like what happens in a lot of things where in the United States, news events die out in a couple of weeks. Is this dying out here? We don't want it to die out. We want it to keep it up at the top of the news and make sure people get it cleaned up by the people who should be cleaning it up.
We've been using the term sort of like an impact statement. What is the impact of what Stewart, Air National Guard, PFAS contamination has had on our community? And we can't answer that question. Like, we don't know, but after this study, we're going to know some more things, right? We're going to know some more things, because you're doing blood and you're doing urine samples. That hasn't happened yet.
Right. And it's going to take time.
And it's going to take time, but at least now, we're in this together. We're fighting through science and through community to really increase the health and welfare of our community members. And thank God you guys are coming with this money, because this is not something that is typical or that we usually hear or get. We're usually at we get the bad stuff. We don't get the good stuff. So this is great for us. And I'm sure Hoosick Falls as well. Our community. Yeah.
Go ahead. So I was just going to summarize. So we have the first document be the community, and then when you mentioned this what we think of as perhaps a second document, where the process that would get into more of the detail of how we're going to get there.
Yeah, and then some of this is for the public and some of it is not for the public. So how are we going to be successful at administering this particular grant? There's a process there. And then some of the documents that are created as a result of us facilitating the success of this grant. So this is an initial document. There's going to be other community-facing documents, and there's a process that you're going to use to, I guess, be successful in this grant.
Okay.
That process stuff are things like you guys are already talking about, hiring staff locally, and we just added some additional detail. As we're talking, I'm thinking, we need to go and approach all of the municipalities in the area. We need to speak to the school board about some of the things that we're talking about. We need to talk to the board at SUNY Orange, possibly, or the Ulster County, SUNY, Orange Ulster BOCES, so that all of the things that now that's process. And at each level of that, there's going to be communication, the outward facing information that you're going to be sharing with them. So I think there's this sort of dual, paperwork that you're sharing with people and presentations and your process documents about how you're going to make this a success. That's what I'm talking about.
Right. Lorene, what about in Hoosick Falls? What's your thinking?
We don't clearly have the issues that Newburgh has because we're so small. So between social media accounts like the village board, putting it on the website, those of us on the CAG group putting it up, spreading the Facebook site. Local media, as you know, is usually in on the CAG group meetings, so that will usually go in like the banner or something. But also, I think once you do the draft and the fact sheets are done, we have a lot of success in the actual poster, right? So if we go put them up in the local tops and the Stewart's and the Cumbies and the village clerk's office, and we paste those all over the place. The local diners, they all have cork boards and stuff. People stop and look at those. And those are very successful in getting the word out for maybe, you know, people who don't even use social media. Some of the elderly folks, they go into all the diners, you know, they go to the Tops grocery store. So we've had a lot of success in other things, you know, posting them about, literally posting them, physically posting them.
Do you agree that having more of a having, you know, maybe revising this initial document a little bit more to be more community focused would be helpful?
The one line that just kept going through my head as everyone was talking was something to the effect of, you know, not again, the scientists won't help scientists learn, but will benefit your family's health outcomes.
Okay.
And that, you know, regarding physician guidance, etc., stuff like that. That's what's going to draw everybody.
Hey,
They know it's going to benefit their family, individually, personally, their children's when they take them to the doctors, they'll sign up. I mean, we had both rounds of biomonitoring. You can't get 100 people in Hoosick Falls to do anything. And we had over 3,000 the first round and over 1,000 the second time. That's a lot here. So I think, and a lot of it is they want to know for their families. So if you toss that in there that it's going to benefit them and the health outcomes of their families, that's going to be the draw.
Yeah. Okay.
But you know, however you carefully word that, health outcome, health guidance.
Yeah.
You know, for your families, that's where it's going to be the beneficial part.
Hey, this is Aura. Can you hear me?
I can. Thank you.
I think hi everyone. I'm also from the city of Newburgh. I think like one thing that keeps coming to my mind from this conversation is that we have kind of like the chance of like this study, like you mentioned, was because like, you know, community members and other people like organized and they, you know, we are here because of that. And I think this is a chance to kind of make it, or like at least because I feel like this is what it is, as to like taking like your health back in your hands, and like there's power and empowerment in like knowing you know how PFAS has affected your health or your community's health. And because of this information and being like one of the first you know cities in this study, like there's power and empowerment in knowing how it's affected your health and what are the next steps. Because of this study, there's going to be more steps. And it's an unfortunate situation, but in order for like more results and actual like, you know, more steps towards fixing those mistakes, we need to know and we need to have these studies. But I feel like if we frame it in a way where it's like empowering people, I think that's what comes to my mind as a community member, and also like as an organizer as well, instead of it just being like a study just for like scientist purposes. I just feel like it's really kind of like a chance to take our health back into our hands and ask for more.
Okay, that's very helpful. Thank you. Gina, do you have questions? Oh, you're on mute.
Can you hear me now?
Yes.
Had a hard time finding my mute button. So it's really exciting to hear this, you know, to hear the perspectives coming from the communities in terms of what we're trying to achieve, because when we developed side A of this information, it was really coming at this as the thought of what does SUNY, Albany, and New York State Department of Health want to put on its website to make all of New Yorkers understand what the multi-site study is about, who is included in this effort, and how it benefits those communities and all New Yorkers. Side B is really the side, I think, where we have a big opportunity to customize and brand for the community, because it's really designed to be more of the community's recruitment tool. And I would encourage us to really focus our efforts on getting in some of the themes that you've talked about here and think about how they can incorporate it. You know, as I was listening in to some of the folks from Newburgh talking about the excitement behind local employment opportunities and, you know, and what that means for the communities. We don't mention this anywhere in these fact sheets. It might be worth devoting space to mention to it. We were so focused on, will these translate? Will they be easy reading? Are they short enough, concise enough? Do they get to the point? And we can redirect them to the website. So this was really kind of, for lack of a better word, the state bureaucrats and the scientist versions of get to know the study and what we're doing with that. So I think, you know, we're limited in terms of how to give it the local flavor, but the communities and the CAP is not. And so we can either spend our time trying to customize side B to make it fit both Newburgh and Hoosick, or we can think about outreach plans developed by the various subcaps about how to use this information and promote it to get all of the themes that you guys are talking about out there and help support, you know, developing the deliverables to do that, and potentially using the local resources you have in the communities to do that, to make it an added benefit. So this conversation is way bigger and more exciting than I came here, that I thought we were going to listen, you know, that we were going to hear. But I just wanted to make clear again that, you know, from a state agency and from SUNY's perspective, we do need to have some kind of side A that also explains the narrative to all of New Yorkers of how we're doing this study, why we're doing the study, how it benefits the communities, and how it benefits New Yorkers. And side B, I think, and I don't need to call it side B because I think they're two different deliverables. We just kind of fashioned it right now as a,
and we, I mean, we don't have to keep them together either.
No, we don't.
And so I'm almost thinking we should just
separate them and turn right. This second, you know, the side about what, if this is information for communities, and let's really make it information for your communities, yeah, and incorporate the information that you guys think makes the best sense.
So the first side, and that really came about after I presented in Rockland, and I realized we needed something statewide that people, we can keep that separate, but I think we can, we'll email this to you so you can look at it. And I do in my head, I think I've always envisioned that we would need to have some documents that incorporated both communities together and other documents that were community specific. So I think this may be one of those situations where, again, we can speak to different aspects. So for example, when we planned the study, the other thing that we're doing is the folks in Newburgh asked us to also measure lead. So we are going to draw, and we'll do this in Hoosick as well. It just tends to be more of a question in Newburgh. We will also be measuring lead in everyone, adults and children. And again, that was something that was asked for. And so things like that we can incorporate.
And you're reminding me, Erin, we did spend quite a bit of time thinking about, should this side that we're looking at be customized? Should there be one for Newburgh? Should there be one for Hoosick? And what I think I'm hearing from you guys today is yes, there should. And we need to really get some of the messaging and the community benefits and concerns flavor in there.
I see Lorraine shaking her head.
I don't think so. I don't think you need to do two separate ones. Again, we don't face the challenges that Newburgh has as far as size. We just don't. So, you know, and we're all looking for the same thing. And that is, you know, So when this, I don't know how, again, I was so focused on here in the beginning, when we got our blood results back, everybody picked up the phone and called the doctor. And the 2 doctors we had in town were overloaded, right? So people know already that there's health issues, okay, related to exposure. So all they need to know, at least from this perspective, is by participating in the study, they're going to get information to help their families go to the doctors with, or conditions to look out for as their children grow. It's going to benefit, again, the words keep coming to me, is health outcomes for your families. And that's why everybody came and got their blood tested, right? That's why everybody came the second time. They want to see that this stuff was getting out of our bodies after the access. And so as far as that goes, I think that's just an all-around statement for both of us. And I don't think you need anything specialized wording for whose it falls. Again, Newburgh's a much more extensive community. You know, there's more language barriers and stuff like that. So if they want their own, I'm okay with that. But I don't think you have to.
But I do sense in both communities, I think community is important, and empowerment and making sure that this is something that speaks to their needs, I think is important. And that is where both communities are very, very similar, as they should be. So here's what I suggest. Gina, would it be possible sometime tomorrow to send me separate this document to 2 pieces, and we'll send both to all of you, and we'll clearly label them so you know which one we're thinking of, the general kind of what we send to everybody around the state information, just general overview of the study itself. But then if you could provide us with some feedback on the community specific document, on ideas on what you think might resonate well and incorporate, and we'll throw some ideas out, and then we'll share that revision with you. Is that okay, Gina? Will that work?
Yeah, I think so. I mean, I think that might either, it's going to end up being that, you know, we can think about changing, you know, making changes to this, to either side of these documents, or perhaps it may pave the way to think about something else that's more community focused, or pave the way to think about what is our media plan going to look like for promoting the study to people, where we're going to get at more things. I mean, one of the themes that I do think we can definitely incorporate in here, and we should be, is looking for opportunities to get more of the community concerns in the document.
Okay, so why don't we start with, you know, people can sleep on it and think of more things. We'll send you the 2 documents and provide feedback, and definitely, you know, this gives us a start too to think about media, not only the media plan, but what other documents we might need. And so we'll ask you that in the email as well and start that conversation too, in terms of what we want to incorporate into our communication and documentation. The other piece we wanted to start talking about is one of the things we're starting to think about, not only for this type of information in terms of outreach in general, but when we go to logistically do the study, you know, clearly we need everything to be in English and Spanish. We've also, you know, based on experience, we know that Haitian Creole is important. And so we're trying to, and I'm not, the nuts and bolts discussion in terms of the invitation letters and how many languages we should send in one letter and things like that, I think will come later. But I wanted to seek your input on translations. We have students that we've hired here and staff members, and also we'll be looking for this when we hire folks in Newburgh that are fluent and can communicate. But you know, will Spanish and Haitian Creole, are there other languages we should be thinking about? How can it guide us a little bit on how we should be thinking about translations?
I'm really not sure if there's anything more
Okay.
there that would be that needed. Maybe Anthony has a better sense of that, being out in the city council and all. He might know more of what they do there. But it's interesting, having been through the school district like I had, that you could very well have people speaking Pakistani or
Yeah.
other kinds of things, but it's not going to be such a large number that you need to have a translation just for that.
Think,
Go ahead.
so from my space, it's and I used the term last time, transcreation of documents as opposed to translation of documents. And so what happens is within ethnicities of Latin Americans, there's cultural, linguistic little nuances, which is again another way you can ingratiate yourself with the community.
Right.
I can just imagine like your students from Albany partnering with our students here in the local high school to transcreate these documents as a part of the community effort to engage all avenues of the community. Think about what that says to the community. That says that every single person that resides in us, because we have a heavy Latinx population, but they're not all from Puerto Rico, right? And so honoring that and validating that and valuing that by just taking this extra step is a tremendous way to engage the community.
No, and I like that idea a lot, in seeking their input and their help in terms of how do we not just translate, but explain and be responsive to questions and to hold, have sessions where we can answer questions and be able to speak to what is appropriate with that. So those are good ideas. And I think, and it's reminding me again that, we have to work all of this into our timeline to make sure we have sufficient time to have that interaction and revisions and things like that, and work that in as part of our plan. And so we can do that. And again, I think if you have contacts that for people, and if it's the same contacts that you were already going to send us, that's great. But this will be another item that we'll add, because I would very much like to have that piece. And then as we get into the planning, the logistics of the study, how best to make sure we are responsive and getting materials to people in the correct language for them would be helpful as we move along. But starting first with assistance with reviewing our materials and helping us with translations, but also as you mentioned, it goes beyond that in terms of being able to explain things in language and terminology that makes sense. So so I think having that as part of our plan is excellent. Okay, I'm gonna find my, so any questions on fact sheets or anything we've just discussed?
I have a question. So because you said something about time frame or timeline, that's a really good piece to put into the fact sheet. And I agree with Lauren about, I think we're same, but there may be like little nuances. So when I think of fact sheets, I think of who, I think of what, I think of where, when, and why, and then I think of how. And so if we can look at the fact sheet from that perspective, so when I get this fact sheet, I know all of those, I know the answers to all of those questions. And similarly, when we go and do community engagement outreach and talking to people about what's about to happen, that's the way we'll have the conversation as well. So that way, when we hear from them, we'll hear their needs, interests, and concerns, and that way we can address and have documents that address it. So because you mentioned time frame, but now I didn't see it in the fact sheet.
Yeah, no, that's true. Okay.
And now we know that we have 2 sites in the location and maybe some more. So it would be, I think it's really helpful to give people that information up front. This is, who's it falls in Newburgh's, when, this is the timeline, or this is the period of time. What, we're going to do these blood tests and urine samples, and we're going to do a research project and a longitudinal study, and how. We're going to have these 2 offices where, if you understand where I'm going.
Yeah, no, that's very helpful. Okay, so we'll send you that those documents tomorrow, and then, you know, again, start this dialogue on how to revise what we currently have, and then moving forward. And so this is also in the email tomorrow, I'll ask you, because I'm conscious of the time, we have revised the Albany website, the DOH website, which will speak to, the two websites will be speaking to one another, but there are things on the DOH website that are not on the Albany website because of the other activities with DOH. For the Albany website, we've put up the published literature that we talked about last time, and I would, you know, so if you have time, and we'll resend it in the email, to please look at that and provide us with feedback. If there's, you know, ways to change it. We do have some translations on the website, and just inviting people, if they have questions, they can either email or call our office, or and we've provided that information with specific questions. One of the questions I had for all of you is, back when we first started talking about putting this literature up there and this information up there for people, we talked about having Q&A sessions, or, you know, I term it a journal club, which is what we would do, you know, what we do with students. Is that something, in how it's been operating since then, is that as both communities reach out and say, hey, we want to hear more about the immunology papers, for example, then we do that. And it can be me, it can be other people, I mean, do that. But I was curious if you wanted to have, if we should have something more formal that people want to, and I know everyone has lots of meetings, but do you want to have regular Q&A or journal discussions, or should we just post things to the website and wait for people to ask questions? Or what is the best mechanism that you feel would be helpful?
Given how many people don't or can't read health studies, and that's not, I'm not saying that to be offensive or anything, they're not easy. You can offer them up like at the community meetings.
Mhm.
I don't know if you necessarily have to go out of your way, because I think if someone comes across a research study and your information is on there on the website and stuff, they can reach out to you.
Okay.
And again, I'm just being a, you know, time considerate and whatnot.
Okay.
You know, I get hit up by a few people here on health issues.
Yeah.
And then I can send them links to the study, but it's, you know.
Okay. And that's
I
what
don't know how much time you need to devote to separate hour-long Q&As
Okay.
on the health data.
All right, and that's kind of how we've set it up. We've put, we hope, really just we've summarized what each paper is, and we've kept it to, we have papers going back 15 years, but we've only put up the ones in the last 5 years, just because it was too much.
I do have some, I only got to recently review some of it, and I do have some questions on it, so can I just shoot you an email tomorrow on those?
Shoot me an email, because we can always, you know, again, this is meant to be a resource for community members, so if there's anything that we can do to make it easier, or, you know, you have feedback, by all means, let us know. And again, we can provide that. Yeah, go ahead.
Making it easier, if you can do like the frequently asked questions piece, to make it more digestible and bite-sized so that people can understand it. For example, so I might have a question, and I don't want to read a 15-page article where that you could sort of synthesize in one space to say, yeah, it impacts your liver, so you want to boil your water. I mean, something, just something very simple and understandable. And the way that I've seen it be most effective is in response to frequently asked questions that we raise, right? So we can raise, you know, what we've done in the past is we create the frequently asked question, and then we provide bite-sized or digestible information. Now we give the full article, right? But we put a synopsis of the article to say this article essentially says, if you can imagine court cases, right? You know, usually they give a real quick synopsis, a couple of paragraphs about what the court held in a particular case. So now you got the gist of it without reading all of the whole 15, 25-page case notes.
Now that might be difficult. So legalese and ATSDR, CDC, DOH being on the hook for some of this. I don't know if you can summarize legally health effects because they're not legally
Right. But what we
identified.
yeah.
You know, the best we can use is the term linked, but then, you know, you don't want to get into legal trouble if 3M, who testified last year that PFAS do not cause health effects, you got to be careful with the frequently asked questions and being specific, right? So that's why the health studies are up. So I'm just throwing in the caution about that wording's got to be extraordinarily careful, and it's not going to be what we want it to be. We want it like, because I can sit here and tell you, I know my breast cancer was caused from PFAS, but I can't legally say that, and the state's going to be even held to a higher standard on what they say as far as health effects goes. So I'm just throwing in that caution that it's not going to say what we want it to.
What
you know,
done is summarized in lay terms each paper, and then there's a link to the actual document.
Right. Oh, yeah, and you know, in even saying maybe linked is, you know,
right.
On legal terms,
right.
it's
terminology, right. What we are working on, just based on two requests with Who's It Falls last week, is, you know, for some of the, like now both communities have asked about the issues around vaccine response and the immunological effects, and there's a statement on the CDC website, and there are a number of articles, but they're under different categories. So we're gonna draft a one-pager that kind of summarizes what the literature says at this date, which is, and then explain what we don't yet know. So we'll play around with that a little bit, maybe circulate that to see, to all of you, to see if that's helpful. Because again, that is a theme, that is a question that we get regularly related to some of these health effects, at least right now, that we can play with. So we'll send the website again to you, as we do with all of our emails. And if you see something, and Lorraine, if you have specific comments, by all means, send them to us, and we can.
And I have two quick questions before we close. So our coalition had a one-on-one with Dr. Bricey a couple weeks ago. And I know in PA, they brought up the same question as we did, that the funding, you had to scale back on the Part B. He said there was absolutely no cuts in funding. And we're looking at each other like,
yeah, I don't.
He absolutely denied it.
Well, that's interesting. So I'll make a note of that. I can't remember. I think our call is next week or the week. It's coming up, so we can. If Pennsylvania was told the same thing, we can inquire.
They told them. Well, they were told by, like, say they're talking like we are here. They were told, like we were told, that some of the stuff had to be refocused because the money. And he was like, So there's that. Right. I want to let you know.
Useful.
And because I don't think we've talked about this since even before we brought the proposal. So optimistically thinking, what if you have 4,000 people sign up for this? How do you narrow it down to the 1,000?
We haven't talked,
or don't we even know yet?
We don't know we actually brought that question up to CDC because we don't want to turn anyone away. And, but we would need the funding. So we will ask that question again. Because that definitely came up, and if we want to include as many people that want to be involved as possible. So we can bring that up again with them and see. I mean, I think at the time they said if you get that many people who want to enroll and are eligible, because there are eligibility criteria, that they'll find a way. But I think that I would like in writing that is. So we'll thank you for that reminder. So we'll follow up on that in terms of what if we do get more people, because we would much rather enroll anyone who's
and was the percentage that you pick would be higher because Newburgh has a higher population, or would ours be higher because we have all the blood work, or you know, all those.
We have no plans to put limits on either. We're not balancing one community against the other. We're treating each community equally in terms of enrollment. We're not going to cap a community so that another community can have more in. We're going to treat our that I can assure you of. What the bigger question is, and it would be great. I would love to have 4,000 people. As an epidemiologist, we always, I mean, it's so hard to get data from a number of people, but we need to, you're right, that we should get some information from them on, will they assist us with that? If we
Can we share in the group here, not necessarily on the flyers or anything, the Academy panel and the group effort that's going into that with the communities? Because I think Newburgh would like to hear that too. I got my invitation Monday morning.
Okay, good. And so you're on are you a liaison?
Yeah, that was nominated by like 5 different people, so I guess so.
So just so everyone's on the same page, there's a National Academy Committee that has been, and we've mentioned this briefly before, that group that has been tasked with reviewing the literature and providing guidance on on the findings and measurements of PFAS and guidance for clinicians. And I serve as one of the scientists on the committee, and we had asked that there be a community advisement. And so Lorene is now on. Do you know of others who have been asked?
I believe them email said there was 50 people at least nominated. I don't know how many they'll end up choosing. All of us, some of us, I don't know that part yet, but I believe there was about 50 people nominated.
And through this, in addition to the liaison community advisory committee, there will be multiple opportunities to testify to the group of scientists, the scientific committee. So with obviously they're always open. So and we've been posting. There's been one meeting that we posted to our study website, and we can be sure and send that information to the CAP, all of the CAP members, when we learn of the dates and the agendas, and we can update, you know, what we know that's open and available to the public is that the meetings are ongoing. It's an 18-month time frame.
And this, and for the communities here, given we're going into the site study stuff, I think they'd really like to follow, because it's a short-term, well, relatively short-term. What they end up with, their results will go directly to the CDC. That will go directly towards 2 physicians for guidance on PFAS impacted folks. So this is going to have, well, I would hope, a more immediate effect than the 5-year study, but this is going to go to guidance to physicians. So this will have direct impact on both our communities, on, you know, family health outcomes and whatnot.
So in that email that we send to you with these documents, we can also send you the link to this committee and the information about it, so that you have it. And we'll also make sure it's on our website, and we'll periodically post, and we'll certainly post when the open meetings are for people to provide testimony. And you can also submit written testimony for this.
I have a suggestion. I think at least one question and answer session would be good to have. Just for like people to hear directly from you all. Because I feel like the website, even though like people will go on and like read the frequently asked questions, I just feel like it's gonna be important kind of like having that space and giving that space to people. So at least like having one session would be good.
Yeah. No, we fully agree. We had actually planned, I mean, I had actually planned this whole year to be going to both communities, all of us, not just me, to do exactly that. Obviously now we're probably more Zoom than not, but right. I was able to get one visit in with down at the church in Newburgh and a few to Falls. So we're hoping to get back into doing that and doing some in-person Q&As, and to, ideally if we can establish some of these relationships with some of the students and community groups, to have them with us, right, and be part of that. So I think that that's going to be critical, and we very much, and again, we'll be looking forward to your help on having, having your input on that. Mr. Lawson has to go off, so thank you very much for your help, and we'll follow up with an email. But yes, thank you. That's an excellent recommendation, and we're very much looking forward to doing those as we can. Okay, so it is 6:30. I think that the next piece, and perhaps to think about, as we get moving, we had talked last time about forming some work groups. So that we might, especially as we develop materials or as we start partnering with different groups, if there are, we'll have the occasional really big meeting, but then perhaps communicate with smaller work groups with shorter turnaround times and things like that can focus on particular issues like around translations, and others are interested in grant opportunities and study mechanisms and things like that. And we can talk more about that next time. But if you have a particular area you'd like to focus on with a CAP, that'd be great. So, okay, we'll send some minutes and the information we've talked about, as we think about our timelines, we'll also reach back out with scheduling the next meeting. But I also anticipate sending some emails with perhaps some questions that we communicate on email as well. All right. Anything else? Any last questions?
I don't have any, but it was a fabulous meeting and very, very productive.
Thank you very much for joining us. This was very informative, and I truly appreciate all the information and engagement. So this is exciting. So thank you all. All right. Have a good night.
Thanks,
Erin.
Bye.
Good night, everyone.
Bye. Bye.